Hey friends, welcome back to the Mama Doc Baby Doc podcast.
Hello, I'm Renda, a board certified OBGYN.
And I'm Rachel, a board certified pediatrician and Renda's oldest daughter. Today we're going to talk about yay, my test is positive. Or oh crap, my test is positive, whichever one
Now
you
what?
are. Basically, like, what are the next steps after you have a positive pregnancy test?
Yeah, so finding out you're pregnant is always an eventful moment, whether the pregnancy is planned or not. Finding out you're pregnant is a life changing event, and most of us will remember that moment for the rest of our lives.
Yeah, I remember my positive test for sure. Yeah, we had been trying to get pregnant, right? So I had been taking pregnancy tests for months. I had been tracking my cycles, and I knew, like, okay, this is the earliest day you can take a pregnancy test. You know how they say, like, a week
Right,
before
right,
your missed period or whatever. So
right.
um, I was at that point where I had done so many tests that honestly, like, I wasn't like excited. It wasn't, I don't know, like the anticipation of it had worn off. So it just kind of became like something I did every single month, if that makes sense.
Right.
So the more I remember it, June 30th, it was that
Wow.
morning. It was my last day of residency.
Wow.
And we were packing the U-Haul that day to move across the country to come to
That's right.
Colorado.
Yeah.
And I woke up early because we had to get an early start for the U-Haul. And I went into the bathroom. And, that was the day I had to take the test. So I took the test, set it on the counter, went, did some other things, wasn't really paying any attention to it. And then as I was about to walk out of the bathroom, I just glanced at it and I saw two lines. You just kind of, after you've had so
Right.
many negative ones, you just expect it to be negative and just throw it away, whatever. It's something you do. But I looked at it and I saw it was positive, and I just remember I was so shocked. And I slowly turned and walked out of the bathroom, and John was like just waking up, and I told him, I said, "I think it's positive." And he was like half asleep. He holds up his hand, he goes, "Yeah," and gave me a high five. And then we packed a U-Haul to move here.
That's awesome.
So yes,
So,
you do. It is something
yeah.
you remember forever.
Yeah, and when you're pregnant, when you find out you're pregnant, it changes your plans a little bit, right?
Yeah.
Most women, when they find out they're pregnant, they start to make changes in their lives, right? You start to eat healthier, maybe you start exercising, and a lot of women wonder when they should tell people, right? Who should
Yeah.
they tell? When should they tell? There's just so many questions.
Yeah. When do you go to the OB? Who do you go to? There's a lot of questions.
Mhm.
So if that's you out there and you're listening and you just got a positive pregnancy test, this is the episode for you. We're going to go over some of the first steps you can do now and things that you should start to think about now that you
Yeah,
have a
that's right.
positive test.
That's right, Rachel. So I think we all agree that good prenatal care is one of the most important things that you can do to have a
Mhm.
healthy pregnancy and a healthy baby. So, as soon as you have a positive pregnancy test, you should call your doctor and schedule your first appointment. Now, some OB doctors will get you in right away for it's kind of a pre OB visit for pregnancy confirmation to make sure you're taking your prenatal vitamins and to talk about risk factors. There's some physicians, though, that will want you to wait until you're about 6 to 8 weeks for your first visit. And that's actually pretty routine because at that first visit, we often like to do an ultrasound to confirm the baby is in the uterus, right? Not an ectopic, and that you have a heartbeat, a baby with a heartbeat. And we can rarely see anything on ultrasound before 6 weeks. Usually 6 to 8 weeks is more common before we can see anything. Yeah.
Yeah, and I know when you first find out you're pregnant, you're already pretty far along. Like, I think I was 3 to 4 weeks pregnant already.
That's right.
Is that
Yes.
pretty common? Yeah.
Yeah, right.
Yeah.
Yeah.
So I mean, it seems like forever to wait to that 6 or 8 weeks when you get to go see an OB, but when you find out, you're normally 3 or 4 weeks along already. And so it's really not that long to go till 6 to 8 weeks. Normally, that's the first time your doctor's going to have an appointment. open anyways.
Right.
But for me, like I said, I found out June 30th. It was the last day of my job in Kentucky, the very last day. And I didn't start my new job until August 1st. So I had all of July off, and I had a lapse in my health insurance for that
Oh,
1 month,
that's right.
which
Yeah.
wouldn't have been a big deal normally, but
Yeah, but now you're pregnant. Yeah.
but then I found out I'm pregnant. And I was also moving to a new town. I didn't really know anyone, and I didn't have a good OB that I knew of. So I ended up not actually going in to my appointment till the middle or end of August. So I was like close to 10, almost out of my first trimester by that point. And I was so ready to have an
I'm
ultrasound because it
sure.
doesn't feel real in your first
Until you
trimester. You're
see
like,
it,
is
right?
that real? Like, I'm not having periods, yes, but that's the only thing that's different.
Right.
So it really made it feel more real. But whether you
Sure.
go in right away or have to wait a couple weeks, you don't have to wait to start doing things to take care of yourself. And if you are not taking a prenatal vitamin, like as an example, you should definitely do so right away.
Right. So prenatal vitamins can make sure that your body has everything that it needs to grow a normal, healthy baby. Folate, in particular, one of the B vitamins, is shown to decrease some birth defects, right? Neural tube defects,
Mhm.
spina bifida, anencephaly. They're really not likely if your folate levels are normal. And that's one of the main differences between regular multivitamins and prenatal vitamins. Prenatal vitamins contain more folic acid. And I also tell patients, even if you're not trying to get pregnant, if there's a possibility that you could get pregnant, you should just be taking vitamins with folate in them regularly.
Yes. And
Yeah.
can I go on a little rant about prenatal vitamins for a
Sure.
minute?
Go ahead.
So we all know, okay, you need to be taking a prenatal vitamin to decrease neural tube defects. I feel like most people know that, but
Right.
neural tube defects, if you don't know what it is, basically what it is embryology. Early on, when your baby is forming in your belly, there's something called the neural tube. And initially it's flat like a piece of paper. And then as you go on and your baby develops more, it kind of curls up into a tube. And that's what makes your spinal canal, your spinal cord, and even like the encasing of your brain as well. So when we say a neural tube defect, it means that tube doesn't close all the way. So that's when you get things like spina bifida, like you said, and anencephaly. Spina bifida meaning the spinal cord isn't closed. So the babies are born with part of their spinal canal and even their cord sometimes out to the air, out open into the air. And then anencephaly, where
Right.
your brain is open out into the air. So these are very scary things that you don't want to have happen. Your spinal cord and your brain are very precious, and you can have really bad effects, neurologic effects, if your spinal cord and your brain aren't enclosed. So that's what a neural tube defect is. They're very rare, with or without a prenatal vitamin. In the United States, neural tube defects are 5 babies are born with them out of 10,000. So for every 10,000 babies that are born, 5 of them will have a neural tube defect. And this is the United States now. So with all of the people in the United States that most people take prenatal vitamins, but in the United States. But the United States actually has a lower prevalence of neural tube defects because we take things like prenatal vitamins that have that folic acid.
Sure. And I think it's nutrition too, right? We have better nutrition than some, especially the developing
Yes.
countries, right?
Yeah. So definitely take your prenatal vitamin. The big thing, and I like what you said about how, anyone should be taking a prenatal vitamin if you're of childbearing age. And this is very, very important. And what I want to make sure everyone knows is that neural tube that closes
Right.
when your baby is developing, that happens around 5 to 6 weeks of when the baby's developing inside of you. And like we said, most people don't find out that they're pregnant until around that time or later. So
Right.
you
So
want to
it can
have that
happen.
folic acid, in your system way before that happens.
Right.
So even if no matter what, you want to be pregnant, you don't want to be pregnant, you should be taking a prenatal vitamin with extra folic acid. Because yes, it would not be fun to have an unplanned pregnancy. It would be even less fun to have an unplanned pregnancy with the baby with spina bifida. So just everyone take a prenatal vitamin starting right now. And I actually brought the one that I'm taking currently. I just get this Nature Made. And this is not a ad for Nature Made. I just this is the one I take. I've taken other brands while I was pregnant as well, but this is the one that I had in my bathroom, so I thought I'd bring it. And you can pick any one that you want out there. What I would recommend though is picking one that has this. I don't know if you can see it. It
USP,
says,
yes,
it's backwards, of course, but USP verified is what you want, because vitamins and supplements are not, no one is checking to see that what they say on the label is actually in there, except for these people. So you definitely want one that says these people have checked it and what they say is in there is actually in there. So,
and that goes for all supplements, right? Not just prenatal vitamins, but any supplement that you take that's not a medication, that's something that you can get over the counter. You should check for the USP seal. Yeah.
Yes, definitely do that. So, so bottom line is take your prenatal vitamin, no matter who you are or what you are. Moving on. Now that my test is positive, I'm taking my prenatal vitamin. I've scheduled my appointment, but it's not for a few more weeks. A lot of people at that point want to know, okay, when is the baby going to be due? How do I determine the due date? And then 40 weeks, that's 10 months, not 9 months. What's going on?
Yeah, well, actually, it's 40 weeks from your last menstrual period. There's something called Naegeli's rule. So now I'm going to teach you some pregnancy math. Are you ready?
Sure.
If you're a woman who has a regular menstrual cycle, and you know the first day of your last period, then you can calculate your estimated due date from the first day of your last period. It's really simple. You subtract 3 months from your last menstrual period and then add 7 days. So for example, if your last menstrual period was on May 2nd, you subtract 3 months, so that's February, and then add 7 days. So 2 plus 7 is 9. So your estimated delivery date would be February 9th.
Yeah, that doesn't sound hard, actually. When you said math, I was like, oh, but actually that's not hard, actually. You can do that.
It's not, right.
But I still just used an app, and I think most people probably do. Sorry.
That's okay. There are lots of apps.
There's so many apps and the really good ones. And they'll calculate your due date for you and then give you other information that's really cool, like how big the baby is and what parts are developing. I used the what to expect when you're expecting one. You know, they have that book. The woman who wrote the book actually has this app that's really cool. And it will calculate your due date for you. But then every week it like tells you, oh, your baby's the size of a lime and it's growing eyes, which was really cool because it's like you could think, oh, there's eyes growing today. So I really like that app. Also not an ad, but it's a good app. But so I know some people can be still really confused about the 40 weeks versus 9 months or 10 months.
And it's because we calculate the estimated due date from the first day of your last period, right? And so obviously that's not conception. Conception usually occurs about 2 weeks into the cycle. So for someone who has a normal 28-day cycle, those first 2 weeks, conception hasn't even happened yet, right? And we do this because the last menstrual period date is a date that we can reliably know, right? Conception is a little bit harder to know, right? Because when ovulation occurs, the egg is released, it starts to make its way down the fallopian tube and down into the uterus. And it can take up to 24 hours before that egg is fertilized. And I don't know if you knew this, but sperm can hang out up to 5 days waiting for an egg. That's right. So if you know when you had sex, the sperm can still be there looking for that egg even 5 days later. Okay.
That's really gross.
Yeah. So
TMI.
yeah. So the other thing is some women can have irregular cycles, right? And that
Mhm.
can make it more difficult to calculate that due date based on the last menstrual period. If your cycle's not a 28-day cycle, you're not really sure when you ovulated. So we found that the most accurate way to date a pregnancy is with an ultrasound. And the best
Yeah.
time to do that dating ultrasound is between 6 and 9 weeks of pregnancy. Those babies are
Mhm.
tiny, they're just a few millimeters. So the measurements generally will give us a good estimate of the due date, usually within 5 days of accuracy if it's done during that time period. Later ultrasounds are not as accurate at predicting the due date. And that's because there's just such a big variation in size of babies, right? A
Mhm.
normal, healthy, full term baby can range from 5 pounds, that can be normal, to sometimes 10 pounds. That can be normal, right?
Oh gosh, yeah. JJ was 7 pounds. 7 pounds is perfect. I don't want to think about having a 10-pound baby at all.
Yeah.
But you know, now that you say that, I remember my ultrasounds always showed that he was measuring bigger. And even my first
Mhm.
ultrasound that I had, he measured 7 days bigger than he should be. And they really talked about moving my due date because he was measuring so big. But like I said, I didn't have mine during that 6 to 9 week window. Mine was almost out of the first
Right.
trimester. So,
Right.
and also we had been trying to get pregnant. So I was tracking my cycles with an app and they were very regular. And I knew the last day of my last menstrual period. I knew what
Right.
my last
Right.
period was for sure
Right.
because we tracked it so well. So that's why they kind of decided not to move my due date. But he was measuring so big. Thank goodness he was just 7 pounds.
I'm so
Would
glad.
have been
Yeah.
bad. um, so I know having an accurate due date is really important,
Mm,
especially, later on in pregnancy when you're kind of trying to decide when to deliver the baby, and even how to best care for your baby. So, like, if you need to be induced for some
right.
reason, like high blood pressure or something,
Yeah. Yeah. My God.
having an
Well, yeah,
accurate due date is important. I'm
right.
joking
Right.
about high blood pressure. If you haven't watched my birth story, go watch it because
Yeah.
I
Yeah.
had some high blood pressure.
Yeah, you're right, Rachel. Having an accurate due date is so important, especially if you are one of the people that end up developing complications in your pregnancy. It will help your doctor and you to determine the best way to care for your baby. And the other thing, though, that I want everybody to keep in mind is that babies come when they are good and ready. And the
Yeah.
estimated due date is just that, it's an estimate. Only God and your baby know for sure when it's the right time for your birth.
That is the truth. Because JJ said, I'm coming at 37 weeks, whether you like it or not. He kicked the door down and came out.
Right. Or John says it was because you sneezed, I think, right? You
He
sneezed in the
did. He
shower?
said, oh, that's another story for another time. I did not
Yeah.
sneeze my baby out.
But
Silly.
37 weeks is still considered full term. Anywhere from 37 weeks to 42 weeks is a safe time to deliver your baby.
Yep.
After 42 weeks, there is significantly increased risk for problems. And then before 37 weeks, babies can have some difficulties also.
Yep.
After 42 weeks, though, there's a higher risk of fetal death. So we really recommend that all babies be delivered by 42 weeks for pretty much all patients. And we do not typically do any elective inductions. And that's an induction of labor without a true medical reason to do it. And we don't do repeat C-sections before 39 weeks. So
No
no
matter
elective
how much you
inductions,
beg.
right? Or
No matter
no
how much you
scheduled
beg.
repeat C-section before 39 weeks. Um, Obviously, if you have a medical problem or a medical indication, that can change. But if you're normal, 39 weeks. And that's because once we get to 39 weeks, there's essentially not really any risk of inadvertently delivering a baby too early, like if we're off on the due date, right? And I do have some patients who choose a delivery, whether that's an induction or a C-section, and they want it at 39 weeks. And then I have other patients who really want to wait for natural labor. And as long as you're healthy and your baby's doing well, it is safe to let your pregnancy progress and wait for labor. And you can do that up until 42 weeks. You have to be monitored to make sure that everything's okay, but you can. However, if you're one of those people that really just prefer an induction at 39 weeks, that's also safe. So the great thing now is that patients, moms get to make that choice on what's best for
Yeah.
them. Yeah.
Yeah, I think that's so important. And really, what's really cool about it these days is that you can kind of make decisions for yourself on what you want to do and what you
Right.
feel like is best for you. Like I chose to deliver in a hospital setting, and I know there are other options out there for patients other than delivering in the hospital. For me, we were moving to a new city, starting new jobs. I
Mhm.
had to find a doctor to take care of me and my baby, and that was hard. Um, and, even though I'm a pediatrician, there's no easy way to choose your OB doctor. And that's such an important decision, too. You're trusting your health to this person. So there's a lot of choices that you have as a mom and in delivering your baby.
Right. Pregnant women have a lot of decisions to make. I
Hmm.
mean, do they want to have an OB physician? Do they want a family doc, a family physician, or
Hmm.
maybe a midwife? And that's the first question. Sometimes this decision depends on where you live, right? Some places, especially remote locations, may have limited access to care. And you'll need to figure out what's available where you live. If you are looking for a provider who is trained to handle every conceivable medical aspect of pregnancy, labor, delivery, and the postpartum period, from the most obvious questions to the most obscure complication, then you're going to want an OB physician. Your OB can provide complete obstetrical care, do a C-section if needed, take care of all your other female health needs. And if your pregnancy is high risk, you may even need to consult with a maternal fetal medicine specialist. And that's an OB doctor who specializes in high risk pregnancies, right?
Yeah, I had
Yeah.
to go see one during my pregnancy because I was old, basically.
You
Because
had a
I'm 30.
geriatric pregnancy.
Because I'm 35, I'm an old lady. So they made me go see a high risk doctor for a little bit, but he said everything looked okay after they did my 20-week ultrasound and sent me back to my doctor. So I loved that I was able to kind of see my doctor through the whole thing. It was really nice.
Yeah,
Um, but I know some family physicians can provide OB care, and this is more and more common in rural settings. Family doctors, primary care doctors, they get training in not just
sure.
primary care to take care of everything, but also maternal care, pediatric care too. So they can be familiar with your whole family and take care of everyone in the family if that's something that is important to you and you want. But if your pregnancy is complicated, they still may end up referring you to an OB physician. And even with kids, too, I get a lot of kids referred to me from our family physicians who are just a little bit
Right.
too complicated for them as well. So, family physicians are great and they can do so much. And what I love about them is they're willing to say, okay, this is too complicated for me now, you got to go see a OB or whatever.
Right.
But they usually can do that and still really remain involved in your care. It's just nice to have
Sure.
someone who knows you really well.
Right, and knows your family, right. Well, that
Hmm.
was the older model of healthcare, right? Small
Hmm.
town family docs, right? Um,
Yeah.
so another option for moms to consider is delivering with a certified nurse midwife.
Yeah.
I personally work with CNMs in my practice, and they provide really excellent and very personal care to low risk pregnancies.
Yeah.
They tend to spend more time with patients, they do more counseling, they offer nutritional advice, breastfeeding support, and they're also more likely to offer complementary or alternative therapies for patients, right? Now, more and more physicians are also offering those types of therapies as well, but midwives typically will be very attentive to emotional well being as well as physical conditions. Um, CNMs or certified nurse midwives deliver babies in hospitals and in birthing centers. Most CNMs use a physician as a backup in case of complications, and that is the model that I practice under. And I really love this model because if everything goes well, the patient can have a delivery that is personal and low intervention and be attended by a midwife. And I have a level of confidence with the midwives that I work with. So I know that if the patient
That's
develops
nice.
a complication in labor or before labor, that they're going to consult with me and that we will work together to provide the best care. So certified nurse midwives, they can also assist the OB doctor during a cesarean delivery if that becomes necessary. Yeah.
That's awesome. That's really
Yeah.
great. I worked with a few midwives at UK when I was in residency, and they were all super nice and really, really great. Um, but I have heard about another category of midwives, direct entry midwives. They're not nurses and don't really have a bachelor's degree. And I think they're more likely to attend home births, and
Right.
some maybe deliver at birthing centers.
Right. So in the town that I live in, we have several certified professional midwives, which are direct entry midwives. Um,
Okay.
and they can be licensed to provide OB care, but I'm going to caution patients considering that route because the level of training of certified professional midwives, and it's a CPM, it's really close to a CNM, and that's unfortunate. But the CPMs, the training that they receive, it really varies substantially. It's not nearly as rigorous as a CNM's training, and also their experience levels can vary greatly. In some states, it's not legal for them to practice. And also their training, it really falls short of most of the international standards, and many would not qualify as midwives in other developed countries. So just be careful. A midwife is not a midwife.
That's
The
good to
C,
know, yeah.
yeah,
I didn't
yeah.
know that. I didn't know the difference, and it's really good to know the different level of training, because I
Mhm.
do know that, there's, like, a trend now to do births at home
Right,
and have them attended by I guess they're CPMs. Um,
right.
and I do know that less than 1% of births in the US are done at home. So, you see them all over TikTok and Instagram, but it's really
Right.
very, very few people who end up doing this. But I can really understand the upside of doing that, of delivering at home. The baby gets there and your whole family's gathered around. It's
Sure.
really loving and sweet, and it's your own home.
Yeah.
So I can understand that. But for me personally, I needed that epidural, and you can't get that at home.
You
So,
cannot. You don't get an
and
epidural at home.
yeah, and I mean, I do know from doing pediatrics that the statistics do show that there's a higher risk for complications to the baby and to the mom for home births compared to a midwife or physician attended birth that is in the hospital. They
Yeah.
just have more complications at home,
Yeah.
unfortunately.
There's definitely increased risk for fetal death,
Yeah.
or compromise. And for mom, the risk is infection and hemorrhage, right? In the community where I live, there are several home birth providers, and they often will transfer patients to me at the hospital when they have these complications. So I personally would never do a home birth. I advise against it. It's just safer in a hospital setting. However, if you are someone who is considering a home birth, you should be low risk. And I would recommend, if possible, that you have a CNM attend your birth, and that they have a consulting physician available, transportation readily available, and live relatively close to a hospital that provides OB care. Yeah.
Yeah, I mean, just like we said in the other episode about planning for your birth, you really can't plan. You really don't know what's going to
You
happen,
don't
and
know.
you don't want to not be prepared for all the things that could happen. And at home, it's just really hard to be prepared for everything. So
Right.
I agree. I want to have all of my babies in the hospital. um, and from
Yeah.
the ped side, like, I know the importance of early intervention for babies. Most babies, they're born, they transition fine, they breathe fine. But if the baby does need support, you really need to get that to them quickly. And they can have really bad long-term complications if you don't get that support to them quickly.
Right.
So, from both sides, OB and peds, I feel like it's really best to have your baby in a hospital. But like you said, if you want to do yours at home, just make sure you have planned for all the things that could go wrong and happen, and talk to your midwife about that. Um, so one last question.
Okay.
When is it safe? When is it
Oh.
safe to tell my family and friends that I'm pregnant? Do I have to wait until 12 weeks? This is something that I know a lot of people talk about, and I'll tell you what I did. But what do you think?
So, this decision is really a personal one, right? I know it's exciting. And when you find out you're pregnant, you just want to tell everyone.
Yeah.
And some patients do, they tell everybody right away. And others like to wait until they're a little bit farther along. I think the issue is that 20 to 30% of all pregnancies are going to result in a miscarriage, and that's a really high percentage. And sometimes if you've told everyone you're pregnant and then you have a miscarriage, it can just make it really difficult when people start asking you about the pregnancy. However, I also think that your friends and your family could provide support to you if you have to go through a loss. So there's good and bad either way. Doctors typically recommend 12 weeks because at that point, the risk of miscarriage is as low as it can ever be. Generally, after the 8-week appointment, when we see the heartbeat, after that, it's really not very likely to miscarry. It can occur, but it's not as frequent. I do tell patients that they can make that decision of who to tell and when, right?
Yeah.
Yeah.
I told everyone right away. I couldn't wait. I was so excited. Definitely.
Right.
And I think, yeah, that's kind of the thing is I realized that there was a risk of miscarriage and then I'd have to go back and tell everyone. But our family were really close and I would want you guys to know that happened to me
Right.
anyways, so you could be there for me. So
Right.
that's why
Yeah.
I kind of chose.
And I'm
I
glad
did.
you told me right away. I think you called me that day.
I think I texted you that picture of the positive pregnancy test the
did.
second I found
You
it.
did. You did.
So yeah,
Yeah.
I told
So it's
everyone.
perfectly
I was so
fine.
excited.
Right. Right.
Yeah.
Well, I hope that this episode helped to clarify some first steps that all pregnant women need to consider as soon as they find out they're pregnant. If this is you and you are newly pregnant, congratulations, yay! And you are about to begin on one of the most exciting journeys of your life, motherhood.
Yeah. It's so true. I love being a mom, and I don't think I really realized how much I would love it until it hit me and I'm here.
Yeah. Yeah.
But anyways, this is the end of our podcast today. Thank you for joining us this week, and we hope to see you back again next week. We do release new episodes every week, so see you next week.
Right. And if you have a recommendation for a future podcast, something that you would like more information about, then please send us a message either in the show notes or on Instagram or Facebook. It's Mama Doc, Baby Doc. See you next
Sounds good.
time.
Bye.
Bye.